Welcome to the Real News Network. I'm Dharna Noor, joining you from Baltimore. This week, the U.S. House voted 237 to 189 to pass a bill that would ban abortions performed after 20 weeks of pregnancy. The bill makes exceptions for cases of rape, incest against minors, and saving mothers' lives, and would not discipline people seeking abortion. Instead, it criminalizes those who perform the abortions or attempt the procedure with fines or up to 5 years in prison. The Trump administration has shown that they support the measure, and it's already been enacted in several states, but critics say it's unconstitutional. Here to talk about all this is Jenny Brown. Jenny Brown was a leader in the grassroots fight to win the contraceptive morning after pill over the counter in 2003 to 2013. She's the co-author of the Red Stockings Organizing Guide, Women's Liberation and National Healthcare, Confronting the Myth of America, and she's also currently project director for National Women's Liberation. Thanks so much for joining us today, Jenny.
Yeah, good to be with you.
So I just want to start by talking about your initial reactions to this bill passing in the House. You know, versions of this 20-week abortion ban bill or the Pain-Capable Unborn Child Protection Act failed in 2013 and 2015, but this time there's support from the White House. So what would this bill passing mean for people seeking abortions, and who would be the most affected?
Well, the bill passing, which I have to say is fairly unlikely because they need to get 60 votes in the Senate. But what would happen, you know, we're told, oh, well, they're not going to criminalize the women, they're just going to criminalize the doctors. When abortion was illegal, women were dragged from their sick beds after having illegal abortions, taken down to the police station and interrogated. You know, the whole idea that you can make something illegal and yet somehow the women will not be affected. The whole point of all of this is, of course, to make it so that women can't get abortions. And when they have a 20-week limit, then that works very well with the other regulations that are now in place in most states, where you have to wait for 24 hours, you have to go back to the clinic, you have to get an ultrasound. All of these things create delays in women's lives. And the idea is, I think it works with this 20-week ban to push a larger number of women over that line until they can't get abortions. So that's the goal here. I think we should be very clear.
I wanted to get your response to sort of one of the ways that this measure is being backed up. So here's a co-sponsor of the measure speaking on the floor of the House. Michigan Representative Paul Mitchell said science has confirmed that fetuses born after 20 weeks feel pain. Here's that clip.
It is said that nations are judged by how we care for our weakest members. There are no more vulnerable than a preborn child, whom unfortunately we fail to protect. The United States is one of only 7 nations that allow elective abortions after 20 weeks of pregnancy, when science confirms that the babies feel pain. Accompanying us on this list are China and North Korea.
What's your response?
Well, he didn't mention that Canada is also on that list. You know, abortion in Canada, for example, is not in the criminal code. And that should be the goal here. Abortion is not a criminal thing, it's a healthcare thing. And it's also women's right to self-determination. So that needs to be the focus, I think, of the movement on this. The whole idea that they're concerned about fetuses feeling pain, this is ridiculous. That, you know, they're not concerned about women being forced into labor. They're not concerned about the child. For example, they just failed to renew the child health insurance program. So that's going to mean a lot of pain for a lot of children. Clearly, this is not what's going on. They're trying to chip away at women's rights. And that's the fundamental thing that's going on here.
It's also been shown that over 98% of people who get abortions actually get them before the 20-week mark. So how did this procedure, or this measure rather, elicit such strong support if it actually affects so few instances of abortion?
Yeah, well, and it affects, it goes along with this thing of trying to delay women's abortions and then force them to come to term. Most women who are having abortions after 20 weeks are doing it for medical reasons, or they have been prevented from getting an abortion before 20 weeks by the expense or the restrictions that have been put in place in many cases. So In a country like Canada, where abortions are funded through a national health system, there aren't any delays while you try to scrape together the $500 to get the abortion. So women who want abortions can get them. It's much easier. Here, there are all these, hurdles that are put in front of us, and so our experience is that the reason that women are often go past 20 weeks is precisely these anti-abortion laws that are trying to prevent us from getting abortion in the first place.
So I want to talk a little bit more about some of the sort of motivations behind those who supported this measure. So Representative Tim Murphy from Pennsylvania, who backed this bill, was just found to have told an extramarital girlfriend to terminate a pregnancy earlier this year. What does that sort of say about the motivations to back such a bill?
Well, I think, we spent about 10 years in a struggle to get the morning after pill over the counter. And the morning after pill is contraception, but we still ran into all of these opponents. And in fact, it was both the Bush and the Obama administration were opposed to putting it over the counter, which made us consider what is actually going on behind all of this stuff. Because when, frequently we're told that these abortion votes aren't really to get rid of abortion, they're really just to excite a grassroots religious base who uses that as a litmus test on voting. But what we discovered is that there is considerable unease if you read conservative think tanks, and even occasionally you'll see it in the New York Times, like Russ Douthat had a column a couple of years ago that was "More Babies, Please." They're very concerned about the birth rate, which is below replacement in the US right now. Replacement rate is 2.1, and it's at 1.86 right now. So they're looking long-term at economic growth, at Social Security. They're very concerned, and they want us to have more children. Of course, women are resisting this because the conditions for having children in the United States are some of the worst in the world. We don't have any paid maternity leave. We're one of maybe 5 countries that don't have any paid maternity leave. We don't have guaranteed health care, as so many other countries have. We're also, our wages are basically supposed to cover childcare, as opposed to countries where you have a childcare system that provides childcare to any child that needs it. So we have very bad conditions, and as a result, women are having fewer children because simply it's hard to do. And so in Europe, for example, they've responded to a lower birth rate by coming up with even more subsidies for childcare, or providing even more, 6 months, a year of paid parental leave for the dads. Here, what we've been getting in response to the lower birth rate is we've been getting more and more difficulty getting abortion rights, and also facing restrictions on birth control.
So some people have just sort of speculated that a late-term abortion ban like this would just encourage women to get abortions earlier if they actually want them. What's your response to this? Is that really what's going to happen?
That it would encourage women to get abortions earlier? Women know when they want abortions.
Right.
It's not like, oh, it's a mystery, and then suddenly at 4 months you decide. This is crazy. I mean, the whole idea is that we should be able to get abortions immediately we want them, and not have these terrible waiting periods and hoops and trying to come up with the money. All of this should be in the past.
And in light of all this, a new report from the World Health Organization shows that almost half of all abortions performed worldwide are unsafe, and that most of the unsafe ones are performed in developing countries, under-resourced countries. In light of all this, talk about why protecting the right to abortion is important and how we can do so.
Well, in our group, we think that it's good to look at the history of how we won abortion rights in the US. And it really was a struggle that was very connected to women's freedom, the women's liberation movement. It was just part of all of the things we need to be able to exist in the society as first-class citizens and full human beings. And so we think that we've gotten away from that, and we are now sort of fighting brush fires defensively. Like on this one, we're going to hear a lot of stories about women who had abortions after 20 weeks and the tragic circumstances, and it was a terrible thing. But we think it's better to just talk about the fundamental right to abortion, that we need it. This is why they're denying it to us. And, rather than having a defensive brush fire on this or that restriction, which there are, almost 500 different restrictions now in the states, we should demand that abortion not be covered by the criminal code. It's not a crime. It's a health issue. And, in Canada, it works fine. We also think that we should have a national health system like they do in so many other countries, and that abortion should be covered. In fact, under Bernie Sanders' Medicare for All plan, abortion would be covered, and that's how it should be.
So I just want to finish up by asking you about what efforts you're engaging in to protect abortion rights with National Women's Liberation and otherwise, and what viewers can do to ensure that women have rights to abortion access.
Yeah, womensliberation.org. You can go there. We have actually been researching the restrictions on the abortion pill. The U.S. got the abortion pill. Basically, it was approved because they were able to make it as expensive and as difficult to get an abortion with the pill as it was to get a surgical abortion. But what we're looking at is that and the whole consortium of doctors have written about this in the New England Journal of Medicine, there are these restrictions that make it impossible to get it at a pharmacy. You have to have it at a clinic. It has to be dispensed by a hospital or a clinic. And these regulations really are designed for extremely dangerous drugs. The abortion pill is not a dangerous drug. In fact, it's extremely safe. It can also be taken much earlier than a surgical abortion can be done. There are a lot of advantages to it, but it's very restricted because you can't just get a prescription from your doctor and go to a pharmacy and fill the prescription. It has to be dispensed by a clinic. That clinic has to be licensed. The people involved have to have gone through a licensing process with the FDA. It's all very complicated. So we think, and there's recently the ACLU has sued on behalf of a Hawaiian doctor. We think that freeing up the abortion pill is an important front in the struggle.
All right, Jenny Brown, she was a leader in the grassroots fight to win the contraceptive morning after pill over the counter. She's the co-author of the Red Stockings organizing guide called Women's Liberation and National Healthcare, Confronting the Myth of America, and she's currently the project director for National Women's Liberation. Thanks so much for being with us today, Jenny.
Thank you very much.
And thank you for joining us on the Real News Network.